Thank you very much for having me here and for coming along to my presentation. I'm a lecturer at the Australian Chiropractic College, so it's very nice to be along here to present at Southern Cross University. So thank you very much for having us along. With my PhD research, I'm doing that at RMIT University, so hence pretty much all of my supervisors are from RMIT, so I'm a bit of a mixed bag in that respect, sort of working from different places. I am, however, looking at balance in older adults, and specifically whether local or focal vibration can improve balance in older adults. The reason I'm sort of doing this is that falls, as you're probably aware, are a very big problem for older adults. I mean, they're a big problem for every age group, but particularly for older adults. It's one of the leading causes of physical injury and death. And if people do actually fall, there's a very good chance that they'll go on to feel anxiety, social isolation, depression, etc. So it's not just the physical aspects that we need to consider when we're thinking about falls, but we also need to look at the psychological aspects and so forth as well. 1 in 3 community dwelling older adults will fall at some stage, and if they do fall, there's a good chance that they will then need to move into aged care, where unfortunately their risk of falling actually increases to 1 in 2. So that's a bit of a problem as well. Obviously, when they move into aged care, there's the loss of independence that results with that, and there's also the cost associated to the individual, to society as a whole, etc. So it's quite a big deal if we can come up with some simple ways of reducing falls risks for individuals. Now, balance is obviously quite linked to falls. It's fairly logical, but it's also been established in the research, thankfully. There are aspects of balance where you need to sort of divide it up into both static and dynamic balance. So static balance is when you're just sort of standing quietly as you're doing whatever you're doing. And then you've got dynamic balance, which is obviously when you're walking along and interacting with your environment and so forth. And they require different responses from the system and the ways that they're integrated, etc. Your sense of movement and where you are within space is critical for your ability to maintain balance. Now, we use our visual system to do that. We also use the vestibular system in our ears, and we also use what is known as the proprioceptive system, which is receptors in our muscles primarily, but also our skin and our joints, that feed back into the nervous system to allow us to maintain an upright balance. And our central nervous system uses that information to be able to keep ourselves upright and maintain an internal representation of where we are in relationship to the environment and so forth. Now, unfortunately, what happens as we age is that all of the systems tend to decline. Both the visual, we tend to lose visual acuity as we get older. We also tend to lose vestibular function, and we also lose proprioceptors, so the muscle spindles and the joint mechanoreceptors and so forth that send that information back into the brain tend to decline. And this is where I'm really looking at making an intervention with older adults. So what would be the consequences of losing proprioceptor input? Now, I'm not sure how familiar people are with neurophysiology and so forth. So, bear with me. If it's not, feel free to chat to me later if you'd like more details. Proprioceptors in the short term, if you lose input from your proprioceptors in your muscles and your skin and so forth, what is going to happen is that you're no longer going to be able to respond to your environment as you should do, simply because your brain isn't going to know where you are in relationship to that environment. Longer term, though, what will happen is that you will get decreasing neuronal function. So your nerve cells rely upon stimulation in order to maintain health in them. And if you're not firing those nerve cells, then they will potentially start to degenerate. And over time, that will then further compromise balance, such that if you say you have a decrease in proprioceptive information coming into the body, the nervous system will almost kind of wind down in effect, such that that same level of activation coming in no longer elicits the same amount of feedback in the nervous system. And this is a problem. So what we want to sort of see is, if we then increase the proprioceptive input from the periphery by using things like vibration on the muscles, can that then improve the central nervous system's ability to respond to balance challenges in the environment and so on? Now, we know that doing exercise improves balance with older adults. Um, Obviously, when you improve balance through exercise, you're going to have aspects of improving muscle bulk, you're going to improve speed of contractions and so forth. So there's going to be all sorts of local effects within the muscles themselves, which could explain a lot of the improvement that you get in balance with exercise. However, you are also going to get a muscle spindle activation. So the receptors within the muscles that feed back into the brain, that is going to be activated through the exercise as well. And it has been shown that repeated exercise builds neuroplasticity within the central nervous system. The problem is, though, that physical exercise is not necessarily great for everybody who is at risk of falls. Some people can't do physical exercise. They may have had surgery. They may have, severely osteoarthritic knees, etc. There can be all sorts of reasons why they're not able to do that. So that's why we're looking at, well, can we use vibration with individuals to potentially give them some of the benefits of physical exercise without them actually needing to do it? Now, it has been shown that locally applied vibration, and locally applied vibration is when you say get a vibration massager and you apply it to a specific area of the body. So there's been quite a bit of research around this, and there's been things with, bone density has been looked at, blood flow, etc. It is quite well known that vibration tends to act on muscle spindles, the same receptors that will be activated by physical exercise. And there has been some research that suggests that vibration is actually beneficial to balance, particularly in older adults. There's been some research that has suggested that short-term vibration improves balance. Whole body vibration can be effective for balance as well. Our little skeleton here on the plate there, he's undergoing what is called whole body vibration. So this, I don't know if any of you are familiar with it or if you've had it done at gyms or whatever, but basically it's this device that you stand on and the platform oscillates backwards and forwards at about sort of 30 to 40 hertz. And the person stands on it in a crouched sort of position and activates all the muscles. It's really quite invigorating when you give it a go. The problem with whole body vibration is that the systems are relatively expensive. You're talking about a couple of $1,000s for a system, which for an individual to use in their home may well be cost prohibitive. It's also not readily portable. So, if you did buy one in your home, it'd kind of have to sit in the corner and you wouldn't really, use it otherwise anywhere else because you can't really stick it in your bag and take it on a holiday with you or whatever. And it's also more physically demanding. The fact that people have to stand in this crouched position means that if they do have severely osteoarthritic knees or hips or, sarcopenia causing weakness in the muscles, etc., they may not be able to actually do whole body vibration. So that's why we're sort of looking at the locally applied vibration aspect. And in particular, the effects of balance, which is self-applied, and I missed self-applied from that last sentence there, but self-applied local vibration hasn't been assessed in the literature. And so that's what I'm looking to do in my PhD research, is that we want to find out, does local vibration, which people apply in their own homes, improve balance in older adults? So there's four parts that we're going to be doing with this. We're going to put together the protocol. We're then going to actually assess a device to make sure it's going to do what we hope it's going to do. We're going to evaluate the feasibility of the protocol, and then we're going to look to actually run a trial of the protocol to see if it does actually make the difference that we hope it does. So the first part's involved a systematic review looking at the existing literature on the use of vibration, local vibration on balance in older adults. We've pretty much finished the data collection on that and the data extraction. We're just sort of looking to write that up now. And we've developed our protocol that we're actually getting the older adults to use in order to improve their balance. We next wanted to look at the vibration device. Now, we were very kindly had some vibration devices donated by a gentleman, Dr. Graham Blennerhassett, who's a chiropractor. He produces Dr. Graham massages. They're very popular within our profession, and he very kindly provided those. So we wanted to look at the vibration parameters provided by this device to see if it fitted within the physiological ranges that produce an effect within the body. And the good news is, to cut a long story short, the device supplies the vibration parameters that we need for our study, and so we're now in a position to be able to use these devices to implement in the pilot study that we're running. So the part 3 was to, or is still, it's ongoing, is to evaluate the practicality of applying the protocol. So, is this device too heavy for older adults to use? Can they actually put it in the right places on their legs? Is it too boring for them to do? Do they, whatever? This is the type of thing we're looking at in this trial. We're looking at the feasibility of running a larger trial as well to actually implement this protocol with people, and also to try and work out our sample size. So basically, we got people into the lab. We did some baseline testing on them. We trained them up in how to apply the protocol. They went away and did it for a week, came back. We retested their balance and so forth. And then if they wanted to, the certain number of people will go away and do it for an additional 5 weeks and then come back, and we've rechecked their balance and looked at whether it's improved and so forth. In particular, what we've sort of looked at is a couple of different measures. We've done some qualitative research in, like I said, asking participants, how did they get on with actually applying the protocol? Was it something that they felt comfortable doing? Was it pleasant? Was it not? Etc. We also looked at vibration sensation, because vibration sensation is a component in the risk of falling. And so if individuals can't feel vibration in their lower limbs, they're at a greater risk of falling. So that was one of the things we looked at. We also did some measures of static balance using a force plate and looked at how much individuals sway as they're standing still. And then we did a thing called the 4-square step test, where basically we get people to do a 4 sort of square step like this, and we time how long it takes them to do that process. And that gives a measure of dynamic balance so that we can look at how much risk the person's at to fall. So we haven't finished data collection, so don't hold me to these figures. But the preliminary data is that most people have found the protocol very easy to apply and even pleasant to apply. After 6 weeks of vibration, the 4-square step test has shown a statistically significant improvement, which is fantastic. Unfortunately, the static balance measures haven't shown any difference. We're not sure quite why that's the case, whether it's just the protocol's rubbish or we just don't have a big enough sample size or whatever. We're just still got to look at the data and try and work out what's going on there. Interestingly, those who had abnormal vibration sensation, which, as I mentioned, is a risk of falls, they all had improved vibration sensation as a result of the protocol. So that suggests that it is having some sort of effect on the nervous system there. We may need to modify the protocol. We may need to adjust where we're applying it, the duration, etc. But it's sort of an ongoing sort of process. And then our final process or final part of this study, we're hopefully going to run a double-blinded controlled crossover study, repeated measures crossover study. So we'll get 2 groups in. First group will just do nothing for 6 weeks. The other group will do vibration for 6 weeks. Then they'll cross over, and the starter group with vibration will do nothing. We'll get to assess the washout effect. So how long does this last for afterwards? And then we'll also be able to look at what happens with the other group when they actually start doing the protocol as well. Okay. Good. So if we can get this to work, it really has the potential to be a nice, easily applied protocol that individuals can apply in their own home. It's very cost effective. This vibration device is under $100 in cost. People, will be able to carry it around with them if they want to do it on holidays, or if they're going up to the Gold Coast from Victoria for the 3 or 4 months that the oldies do, etc. So that will hopefully be effective. So thank you very much. Anybody got any questions? Yep.
Thanks, Matthew. Excellent. Yeah. Comments, questions?
Sorry. Whereabouts are you applying the vibration in the body to actually stimulate, improving balance? So what part of the body is it part of your protocol to actually stimulate?
Yes, exactly. Yeah. So no, that's fine. So there's 4 points on the thigh. So they're doing anterior, medial, lateral, and posterior, and then the anterior leg here, and then the posterior leg. We may need to include doing some vibration stimulation on the feet, because some of the data that's come out of the systematic reviews sort of saying the feet can be quite effective as well. But at the moment, it's probably 60% thigh, 40% leg. So yeah.
And then my second one for future thought is, how would you be able to apply this to people, so again, community, intellectual impairments, acquired brain injuries, balance is a big thing, as well as that aging, as well as people, mainly intellectual impairments and acquired brain injuries or TBI.
Yes.
How do you see your research eventually maybe impacting the more diverse?
Yes, that's an interesting question. I mean, one thing that's sort of become apparent from doing the literature review and my private practice, because I primarily work with balance disorders and so forth in private practice, is that you almost need to have a deficit in order for this to work. I mean, this is part of the reason why I suspect that this pilot study hasn't shown a statistically significant improvement with the static balance measures, is that we've drawn upon a very wide range of individuals. Whereas if you have somebody, if we just went with people, say, that had a vibration deficit, that said that they have some sort of sensory change going on already, then it's possible the vibration will therefore have a bigger effect. So with respect to those other groups, it's going to sort of depend upon what the pre-existing injuries are and the consequences of those injuries and the changes in brain function that has resulted from that, as to whether or not it would. I do quite a bit of work with other brain-based disorders and use vibration stimulation quite often purely as a somatosensory stimulation to the brain. And I do it with people with concussion and so forth. So yes, very applicable in that respect would be the short answer. Yeah. Cool.
Question at the back.
I just wondering, 6 weeks, what's an idea? Do they have to do it daily and for how long?
Yeah, so it was a minute per leg. Every day for 6 weeks was what we asked for. So that's the other thing about it, is that it really doesn't take very long to do. A lot of people sort of said, well, a minute doesn't seem very long. Why just a minute? But there's habituation effects that you need to look at, in that the central nervous system will decrease its response to something when you apply. If you applied it for 10 minutes, the response that you'll get centrally will gradually diminish over time. And so, is it worth them applying it for 10 minutes when you can just do it for 1 minute and get a similar effect? So, yeah. Good question?
Yeah. Not really a question, just a comment that it's just great that you're making it so accessible, because there's so many interventions out there, but it's all a matter of who has access to it. And so, yeah, it's great.
Yeah, thank you. Yeah, because that was really kind of what drove me to do this, was that it's just so easy. Why everybody should be able to do this, and hopefully it'll work. So, yeah. Cool.
Okay,
Good.
Thank you very much,
you.
Matthew. Well done.
Cheers.
Thank you. Very thorough.